Good morning, everyone. My first talk will be on female pelvic pain in the acute setting. The differential diagnosis for acute pelvic pain is vast, and the etiology may be divided into anatomical location. It may be related to age or pregnancy status. It may be related to neoplasm, either benign or malignant, and there are miscellaneous causes. When a patient presents with acute pelvic pain, we need to take a history, a physical exam, we need to perform laboratory studies, we need to perform imaging, and then we need to know whether the patient is an adolescent, a woman of reproductive age, or postmenopausal. We have an algorithm that we use when a patient presents. We want to take a history, a physical exam, and a pregnancy test. So is the patient pregnant? If the patient is pregnant, we may be suspicious for ectopic pregnancy. If not, we want to know, does this patient have right lower quadrant pain? If the patient does, we may be suspicious for acute appendicitis. If not, we want to know, does the patient have cervical motion tenderness, uterine or adnexal tenderness? If yes, then maybe they have pelvic inflammatory disease. If not, is there a pelvic mass? If there is, we may be suspicious for uterine or ovarian pathology. If not, we want to know, does the patient have dysuria or white blood cells in their urine? If yes, we may be suspicious for pyelonephritis or cystitis. If not, we want to know, does the patient have hematuria? If so, we want to be suspicious for vaginal bleeding or a stone. To assess pelvic pathology, ultrasound is utilized as the primary imaging modality. CT is utilized to evaluate for pelvic abscess or hematoma, postpartum complications, pelvic inflammatory disease, bowel disease, and malignancy. MRI is useful for evaluation of adnexal masses and uterine anatomy, and PET scanning is useful for evaluation of pelvic malignancies. Computed tomography is often performed when a GYN disorder is not initially suspected. It's utilized when ultrasound findings are equivocal, when the abnormality extends beyond the field of view, and when further characterization of pelvic diseases is required. Therefore, we need to be familiar with the appearance of GYN pathology on other imaging modalities, including CT and MR. However, computed tomography uses ionizing radiation. Magnetic resonance imaging offers high contrast resolution, excellent tissue characterization, and multiplanar imaging capability. However, it is expensive and less readily available. The benefit of magnetic resonance imaging in all age groups, there's no ionizing radiation. In this session, we want to discuss the common causes of pelvic pain. We will review key differential diagnoses, and we want to identify imaging features of various conditions.